What's happening in prostate cancer now? You know, we've heard about prostate cancer. I'm sure everyone knows somebody who's had prostate cancer as a friend. And I think prostate cancer, the way we address it now, has been changing. 1 in 6 men will be diagnosed with prostate cancer. That's a lot. 230,000 men are diagnosed a year. 30,000 will actually die of prostate cancer per year. So what does that mean? We diagnose a lot of people and they live a long time. So if we look at it, 55 to 59, that's when the incidence of prostate cancer starts increasing, and really the highest incidence is in the early 70s, late 60s. So what are the risk factors? If you have an uncle on your dad's side, a brother, or your father, 1 first degree, you get a 2-fold increased risk, meaning 1 in 3 men who have a family member with prostate cancer are also going to get prostate cancer. If you have a 1st degree and a 2nd degree, boy, it's a severely increased risk. 20 years ago, we started using PSA, this blood test to find prostate cancer. And we started finding a lot more. And in fact, the death rate from prostate cancer went down by 40%. And now as data develops, and there's a lot of controversy about PSA screening, should we do it, shouldn't we do it? We know we're still finding it earlier and we're curing it, but some people are getting overtreated, meaning they didn't need treatment for their prostate cancer. They weren't going to die of it in the first place. So what we're working on now is figuring out who are those people that really need treatment. So how do we screen for prostate cancer? You know, you go to the doctor, we do a rectal exam, but if I really feel a big bump on a rectal exam, we've probably missed the boat. Because 50% of the time, if I can feel it, kind of like a breast lump versus a small thing we find in a mammogram, that's the purpose of PSA. 90% of the time, the cancer is still within the gland. So who needs a biopsy? So we do all this stuff. We do the rectal exam, we don't find any bump, but we did a PSA. The PSA is greater than 4. We would say you need to have a prostate biopsy. The only way to diagnose prostate cancer is with tissue diagnosis. But the 3 goals of anything we do, whether we use radiation, whether we use surgery, whatever type of surgery, we want to get rid of the cancer. We don't want people to leak urine. And if they're able to get erections, it should be nice for them to be able to have erections after the surgery. So, is surgery good? Surgery is the most definitive thing you can do. If all the cancer is in that prostate and we remove the prostate, you're cured. What we don't know is the medium risk and the high risk people, their Gleason score is worse. Those kind of cancers want to escape from the prostate. The low risk, look how good we do. At 5 years, 92% of people are cured. The question is this: how many of those people were going to die of their prostate cancer anyway? And did we overtreat them? Should we have watched them for a while? And I think age is a big part of that. It's very hard for me to say to a 50-year-old man, I'm going to watch you for the next 30 years. Because give 30 years, that cancer is going to do something. But the 73-year-old, maybe I've overtreated him here. And then the risk of leakage and other problems. The high risk, at 5 years after surgery, 65% in their study were okay. But when we follow it out, only 50% are not going to have PSA come back because cells got out before we did something. Active surveillance, I think this is the big thing that we've realized in the last 5 to 10 years, that there's many men we're going to diagnose. Not everybody needs treatment. A lot of men can be watched. And I think 25% of the people I diagnose now with prostate cancer, I tell them, don't do anything. Let's watch it for a while. Now, in the last 5 years, there's been 5 new medications. They're all very expensive, and we don't know how to use them the best way in combination with each other. But it's a very exciting time for urologists and for medical oncologists because now we have options. Prostate cancer, when someone's given that diagnosis, doesn't mean that they're going to die of it. Some are going to, but many live a long life with prostate cancer or having been treated for prostate cancer.